Falls are a leading cause of injury, disability, and death among the elderly. Up to 50% of institutionalized elderly fall each year. In order to help decrease patient falls, it is important that we educate staff about the following topics: fall assessments, environmental hazards, use of assistive devices, and medications. There are several standardized and predictive fall risk assessment tools. It was found that using a fall risk assessment tool on admission caught 54% of fall risk patients compared to only 38% for those not using the tool. Fall risk assessment tools need to be carefully chosen and evaluated for their appropriateness. In different settings, there needs to be different tools used. For example, evidence shows that tools developed for acute care may not be suitable for long-term care settings. Evidence-based fall prevention strategies are the least developed area of patient falls research, but are critical to preventing injuries and deaths from fall.
It is important to ensure staff knowledge about fall prevention and documentation, communicating high-risk patients and previous falls during report and patient transfers. Interventions targeted at environmental risks in facilities are effective in preventing falls. Wearing shoes, clutter-free rooms, ensure locks are on wheelchairs, beds, and safety belts. Bed alarms, bed rails, and personal alarms. Completing safety rounds. Instruct patient to call for assistance when needed. Ongoing evaluation and patient education is key to fall prevention. Consider referring high-risk patients to OT and community resources.
Declines in balance and mobility are often age-related changes. On average, 10,000 adults turn 65 years old each day, and a quarter of these adults are expected to live into their 90s. In 2013, 1 in 6 adults aged 65 years or older had reported using an assistive device, such as a walker, cane, or wheelchair. These devices can be an asset for those with physical disabilities and limitations. These devices can also help improve balance and mobility to reduce fall risk by reducing pressure on joints and limbs. However, if these tools are used improperly, the risk for falls increases dramatically. In one study, it was found that those who used an assistive device were more likely to report falling in the last 3 months than non-users. While using a national representation of data on fall-related injuries, more than 47,000 fall-related injuries each year were associated with canes and walkers. The older population is increasing, thus the use of assistive devices will increase along with this over the next decade. As healthcare professionals, we must ensure that our clients understand how to use their device and that their device is fitting for our clients' needs and body size. Clients should have proper teaching regarding their assistive device for proper gait techniques, the use of safety belts, along with proper device prescription, fit, and training to reduce fall risk for fall-related injuries related to assistive devices.
Medication reviews and reconciliations are major interventions we can do as nurses to help decrease falls. Studies have identified 81 medications that have shown to increase the risk for falls. Some drug classifications to keep your eye out for when doing your review are anticholinergic, anti-Parkinson agents, anti-infective, cardiovascular, antiarrhythmic drugs. These drugs can cause dizziness, hypnotic, and sedative effects. Organizing medical patients as they are not up and down throughout the night.
To summarize, by using the proper assessment tools, being aware of environmental hazards, ensuring your client has proper education regarding their assistive device, and by knowing which medications may impair your client's mobility and balance, we are able to reduce the risk of falls and further ensure our client's safety.